Y'all know I am a huge fan of out-of-hospital births. I had one myself not too long ago, but a lot of moms just feel more comfortable at a hospital. And if that's you, great. I support that 100%. And I will also add that even if you are planning to stay home or go to a birth center, the reality is that you still might need to transfer. This happened to my sister. She was at the birth center, literally pushing her baby out when they found meconium in her waters and they had to rush her to the local hospital. Her baby was born perfectly fine and healthy, but they did need to take that extra precaution for her daughter's safety. It happens. Either way, wherever you're planning to give birth, you should be prepared to navigate hospital protocol just in case. By the end of this video, you will know how to do just that by avoiding these top 8 mistakes made at hospital births so you can achieve an awesome natural birth. But first, my name is Maria. I'm a Lamaze-Certified childbirth educator and owner of the app Natural Birth by Echo, a free resource with all of the tips and tricks you need to make your unmedicated birth a positive one. Okay, the first thing that mamas get wrong, just in general, both in and outside of the hospital, is lacking birth education. I had a cousin who went in for her induction and they asked her, "What's your birth plan?" She said, "Birth plan? I don't know, you're the doctor, you tell me." She had done literally no research into any of her options, and so her birth went the way somebody else wanted it to go. It's important to take a birth education course, read books, watch my YouTube channel so that you go in knowing what interventions you do or don't want, what kind of birth is best for you, and how you want to achieve it. I'll also add here that you want to avoid a hospital-taught birth course. Hospital courses are geared toward making you a good and convenient patient, but they will not help you understand pain management, your birth partner's role, your body's own physiological birthing process. Not to mention, hospital courses are not evidence-based, which is it's kind of shocking, right? They're not evidence-based, they're protocol-based. For example, the drug Cytotec is widely used as a cervical ripening agent in the hospital setting. It's just standard protocol. However, Cytotec is extremely dangerous. It has been banned for use in labor by the FDA because it causes, are you ready for it? Stillbirth, death to the mother, as well as birth defects to the child. But you won't be told any of that. You're just going to be told, here are the stages where we administer the Cytotec. Their goal is teaching you to be a good patient and to get on board with their protocol. But your goal is having an awesome birth. So what you want is an evidence-based birth course. And if you want to look into mine, it is linked below. It is a completely evidence-based, highly effective childbirth education course that takes you through everything from how to prepare yourself during pregnancy, how to have an awesome birth, and how to navigate postpartum as a natural-minded mother. Not to mention, I'll be joining you. The course follows my own pregnancy as I use the very tools I share with you to achieve my second beautiful unmedicated birth. All right, the second thing that I see go wrong with hospital births is pushing on your back. Don't push on your back. The SI joint is a little bone in your pelvis that is designed to open during childbirth to allow your baby through. Lying on your back locks the SI joint in place, which then closes the pelvis by up to 30%. It's like squeezing a rock through a tube of toothpaste. It's a whole lot more effort and it causes a ton of damage. Moms experience longer pushing times, vaginal tearing, and severe damage to the pelvic floor. So don't push on your back. And you might be wondering at this point why all photos and movies show women exclusively pushing on their backs. This is because the supine position is more convenient for hospital staff, so they often pressure women into getting on their backs. Just remember, you can say no. This is your birth. This is your baby. You don't have to do anything you don't want to do. Speaking of things you don't want to do, cervical exams are the third mistake made in hospital births. Now, cervical exams do have a time and place, but you don't want to put a whole lot of stock into them for a few reasons. First, dilation does not correspond to when your baby will actually be born. You could be, 4 centimeters long and give birth in 30 minutes. You could also be 10 centimeters long and still not give birth for hours, even days. Women dilate at vastly different rates. It means little to nothing. Not to mention, getting your cervix checked is extremely uncomfortable. So you're in labor, you're trying to focus and breathe through contractions, and you've got a stranger's hand digging around your lady parts. No thank you. That's painful, it's stressful, and this discomfort tells your primal brain, I'm not safe. I can't have my baby here. Your brain then releases catecholamines to slow labor down or even stop it altogether. This is just your brilliant body doing what it can to protect your baby from a perceived threat. And it's part of the reason why hospital births are on average 3 hours longer, because most women just don't feel as comfortable in this setting. So if a staff member is pestering you for repeated cervical exams, remember, it's your body and you can say no. The fourth most common mistake seen at hospital births is lighting. In movies and birth videos, the setting often looks like this, but those bright, sterile lights actually cause more pain to mom and prolong her labor. Here's why. When lights are low, our brain releases the sleep hormone melatonin, which is one of the body's natural painkillers. The minute the lights come on, melatonin production stops and boom, you're in more pain. In addition to added pain, those bright lights also cause labor to stall due to the release of, again, catecholamines. The pain is stressful, stress causes the release of catecholamines, and catecholamines slow labor down. So longer birth and more painful birth just from having the lights on? Absolutely not. Just lower the lights. Hospitals often have the lights on by default. If this is your situation, let dad know your preferences and have him be the light Nazi, because this is not the time for you to be arguing with anybody. You need to focus, or if you are stuck in a waiting room and you have no control over lighting whatsoever, use sunglasses, a bandana over your face, whatever you need to keep your melatonin levels high so labor progresses quickly and easily. The fifth thing that most moms get wrong in the hospital setting is bringing a birth partner who isn't prepared. A lot of moms go into it thinking, I'm the one giving birth, so dad doesn't need to prepare in any way. Wrong. Study after study after study shows that good emotional support lowers the perception of pain, it shortens labor, it reduces the need for interventions. Dad, it's not the doctor who's providing all of these benefits. It's you. Aside from mom, you are the most important person present at this birth, and I can personally attest that labor support is so important. There is no way either of my births would have gone as well as they did without my husband's support. He knew exactly what to do, and when I was pregnant with our first, he took that birth education course with me. He read those books. We did our labor rehearsals, and when I did have to get transferred to the hospital because my baby was so high risk, it all turned out okay because my amazing husband was so well prepared to support me. So birth partners, this one's on you. Do your research, take that birth course, and you're gonna do great. Speaking of birth courses, mine is linked below. The Echo Natural Birth Course is completely evidence-based, highly effective. Women all over the world have had beautiful experiences using these simple evidence-based strategies to naturally lower pain and avoid interventions, and I would love it for you to join us. Okay, number 6, continuous electronic fetal monitoring, or EFM. This is where a monitor is used to track the baby's heart rate throughout the labor process, and it sounds like a great idea. Keep track of the baby, make sure they're doing okay. However, the data shows otherwise. Continuous EFM is linked to increased C-section rates without a corresponding increase in mothers and babies saved. This is because EFM monitors are notorious for false alarms. It looks like an emergency, they rush to a C-section and, oh look, false alarm, the baby's fine. A friend of mine was in labor when her monitor showed the baby's heartbeat was dangerously low. They rushed her to the OR where they operated quickly only to discover that the baby was okay. What had happened was the nurse had not adjusted the monitor correctly and it mistakenly showed the baby was in danger. So this mom had a completely unnecessary and dangerous surgical delivery. Sadly, her story is not a standalone. One study, and I'll link it below, it showed that continuous fetal monitoring is associated with an 81% increase in the C-section rate for both high and low risk mothers. An 81% increase in C-sections without a corresponding increase in lives saved. An easy alternative to continuous EFM is intermittent EFM, where a birth worker, typically a nurse, comes by to manually check the baby's heartbeat with a fetoscope or a Doppler and look for patterns. Because it's done manually and more time is taken, there's less room for error with intermittent EFM, and it has been found to be effective at detecting true emergencies, saving babies' lives, as well as keeping the C-section rate low. So make sure that intermittent EFM has a spot on your birth plan. Okay, the seventh thing that hospital births often get wrong is actually right after the birth, and that is clamping the cord too soon. You want to wait a minimum of 3 to 5 minutes, or better yet, wait until the cord has turned white and stopped pulsing. There's no rush. About 30% of your baby's blood supply is still in the cord, so you need to give it time to flow into your baby's body. If you take a look at these two photos, the one on the left shows the baby right after birth. He's leaner, he has less color, and notice the cord, it's blue, meaning that there's blood still flowing into his little body. Just minutes later, on the right, you see the same baby is more robust. He's pink, he looks healthier and stronger, and look at the cord. It's white, meaning all of his blood is now in his body where it belongs. Unfortunately, delayed cord clamping is not routine in most hospitals. They cut the cord too early, and babies lack up to 30% of their blood volume. Imagine if you lost 30% of your blood volume. There would be concerns for you as an adult. When a newborn loses 30% of their blood supply, they are more likely to have breathing problems, breastfeeding problems, low iron levels, and preemies are much less likely to survive. All this to say, don't touch that cord for at least 3 to 5 minutes after birth. Okay, the final thing that most hospitals get wrong is the golden hour, or lack thereof. The golden hour is simply the first hour or so after birth where the baby goes immediately skin to skin with mom and nobody disturbs them. Having this first hour to bond and get to know one another has been shown to increase breastfeeding rates, it reduces mom's risk of postpartum hemorrhage, and it establishes a strong connection between mother and child. Fortunately, a lot of hospitals are starting to implement the golden hour as part of standard postpartum care. Unfortunately, many still take the baby away from the mom. They weigh the baby, they measure the baby, they wipe him down, and then they hand mom a neatly wrapped little bundle. But this is not biologically normal. It is harmful to the mother, it is harmful to the baby, and it has damaging effects on breastfeeding and bonding. Mom, if you're in this situation, you just gave birth. So you're likely going to be too exhausted to be all like, oh, give me my baby back. So dad, doula, whoever is there with you, it is their job to make sure that you get your uninterrupted golden hour. Because barring a life-threatening emergency, this is not something you should have to compromise on. Okay, that wraps up the top 8 mistakes made at hospital births. If you liked this video, you are gonna love my other stuff. So hit subscribe for evidence-based tips on avoiding interventions and achieving the positive, natural birth you're hoping for, and I will see you next time.